Hello and welcome to your preoperative video. This video is designed to give you all the instructions that you need before your surgery tomorrow. And after you're done watching this video, we're going to meet a person who will go over all your lab work, all your clearances, and I will be able to answer any additional questions that you may have before finishing your preoperative visit. This information is general, regardless of the surgery that you're getting, and specifics for your operation will be discussed in just a few minutes when we meet. So tomorrow, when you come in for your operation, please wear a robe, a regular bathrobe. It's just easier to have you get dressed after the operation. Please wear comfortable shoes, preferably slides, so that you don't have to worry about putting on sneakers or something that's more difficult. Remember to bring a pair of socks with you. It's very cold in the operating room, and I want you to keep your socks on top of the compression stockings that will be given to you in the photo room. Once you change in the photo room tomorrow morning, I will come in, I will do all the markings, I'll answer any additional questions that you may have. You will then meet with one of our anesthesiologists, and it will be able to go into the operating room. Once you're on the operating room table, our anesthesiologist will put in an IV, give you some relaxing medication, and the next thing you know, you'll be in the recovery room. Depending on the operation that you're going to have, you're going to have a surgical garment on, whether it'll be a compression garment, a bra, a binder for a tummy tuck. We will discuss in person, but remember that any of these garments are there just for you to be comfortable. None of them do anything for your results. And if you feel like you need a break from your garment, there's absolutely no problem. It's totally okay to open or take off, make it tighter, make it looser. Whatever it is that you feel you need to adjust to be comfortable is perfectly okay. Now, when you get home after surgery, you're going to feel pretty groggy. You're going to be very sleepy. And it is perfectly okay to sleep off the anesthesia. But when you wake up, please make sure that you get out of bed. Take your pain medicine, get your pain under control, and come out of bed. Make sure just moving your feet in bed is not enough. You have to ensure, even if you make laps around the room, but you are moving. Have your family or friends help you, but please keep moving. There's no set rule as to how much you have to move, as long as every once in a while, when you're awake, you get out of bed and you move. If you are laying in bed and you're awake, I would like for you to move your feet in this manner, up and down 20 to 30 times every hour that you're awake. I also want you to take slow, deep breaths, regardless of the surgery that you had. You want to breathe in deep and exhale. You do that 10 times every hour that you're in bed, because that will help to reopen up your lungs and minimize the risk for pneumonia. You are going to be given 3 prescriptions. One will be for pain medication. Typically, it's Percocet. If you don't do well with Percocet, please let me know, and I'm able to give you something different instead of it. But you will need your narcotic pain medication in order to control your pain. Now, before surgery, and we will confirm in person, you have not been taking any Advil, Aleve, aspirin, ibuprofen, none of the NSAIDs. However, after surgery, I'm perfectly okay with you taking Advil in between the Percocet. Remember, if you take Percocet, you cannot take Tylenol. It has to be Advil, because there's Tylenol inside the Percocet and you don't want to double dose. The second prescription will be for an antibiotic. You're going to start your antibiotic the day after surgery, and you will take it either for 7 days if you have no drains. If your operation involves drains, you will continue to take the antibiotics until all the drains are removed. The third prescription is for nausea, and you take that only if you feel nauseous. If you don't feel nauseous, there's no need to take it. Keep it on standby just in case. Also, other than the 3 prescriptions that you're going to get, I would like for you to have handy vitamin C, folic acid, and protein shakes, especially if you're having a fairly large operation that involves maybe breast lift or reduction, tummy tucks, liposuction, because these supplements will help your body heal better and faster. The other thing that will be very important for you to get in the pharmacy is Colace, which is a stool softener, and Metamucil capsules. These two medications are over the counter, and they will help to regulate your bowel function so that you don't end up in a position where between general anesthesia and narcotics, you get very constipated. So do watch your bowel function after surgery. Make sure that in a few days after you resume normal bowel function. And if you don't, then perhaps consider doing an enema or take Marilex, something that will resume your normal bowel function so you can go. The other thing that will be very helpful if you're having lipo or tummy tucks or breast surgeries is to buy a pack of maxi pads, regular maxi pads that the girls use for their periods. Because maxi pads are wonderful, especially after lipo, where you can put them right where the little cuts are, and that will help to catch the fluid that's coming out as you're draining. I do not use drains for my liposuction patients. So the first 24 hours, it does get very messy because the fluid has to come out. And maxi pads come very, very handy. So just have a big pack of maxi pads ready when you're at the pharmacy. Just pick them up. And maybe even a small box of Band-Aids. So wherever there are little holes, you can simply remove the old Band-Aid that's dirty and put a clean one in. That you're getting a real operation. And for those of you who are from out of town, if God forbid there is a problem, a complication, an issue that arises, it means that you may potentially have to come back to see me. I remind patients of that because often many of my patients forget that it is a real operation. There's always potential risks, such as infection, bleeding, pore scarring, potential need for revision surgery, anesthesia-related complication. Specific complications pertaining to your operation, I will review with you in a moment when we meet in person, but all of my surgical patients will have my cell phone number, including yourself. This cell phone number is available to you 24/7. That means that if you have any questions, any concerns, or any issues, you have a way of getting in touch with me or my team. Now, I do ask that if the question is not urgent, that you text us during normal day hours. But if something really worries you and it is after hours, it's never a problem. Please always feel free to text. Always ask that you text me. Don't call. And it's not because I don't want to speak to my patients. It's my only way of keeping a communication record of what we discussed. Otherwise, it becomes impossible to remember. If I speak to you on the phone, a week passes by and I just don't remember what we spoke about. In terms of your post-operative care, the day after surgery, you will come in to see us for your 24-hour post-op. We're going to check, make sure that everything is okay. The following time you will come, if you're still here in Miami, if you're from out of town, will be in 1 week. If you have already gone home, I do ask that 1 week after surgery, you send me pictures of the area that was operated on. You can avoid including your face if your face is not involved, and confirm with me that you're doing fine, that you have no problems. And the pictures will also ensure that things are going well and there are no problems. I do ask that my patients follow up with another set of pictures a month after surgery and then 3 months after surgery, unless, of course, you have any issues or concerns. Remember, you have my cell phone number. You can get in touch with me at any time. Okay, so as we come to the end of this video, I gave you all the general information that you need to know before your surgery tomorrow. And in a few minutes, we're going to meet and I will answer any additional questions you may have. And I will also go over all the potential things that you need to be aware of pertaining to your specific operation. Thank you very much for your attention and for watching. And I hope this is helpful. And I'll see you in just a few moments.